Assalamualaikum and good evening, ladies and gentlemen. You're now with me, Muhammad Yusuf, for TVS News at 5. Let us begin with our top story. The White Health Paper in Sarawak is a comprehensive policy document that outlines the health priorities, strategies and goals for the state. During the town hall session held at Sarawak General Hospital earlier today, Health Minister Dr. Zaliha Mustafa discussed the key initiatives and priorities outlined, including the need to improve access to healthcare services, particularly in rural areas, and the importance of addressing non-communicable diseases such as diabetes, hypertension and cancer. Our reporter, Lorenzo Isaac, has the report. Lorenzo, over to you.
Thank you, Yusuf. Currently, I'm at the press conference room waiting for our Health Minister, Dr. Zaliha Mustafa, to give her answers regarding the White Health Paper Town Hall session that has been held earlier today. So let me give you a bit of info of what the White Health Paper is. So the White Health Paper in Sarawak is a comprehensive policy document that aims to guide the development of healthcare policies and programs in state. And this paper provides an overview of the current state of health in Sarawak, identifies health priorities and outlines strategies and action plans to achieve these priorities. The document was developed through a consultative process involving stakeholders from various sectors, including government agencies, healthcare providers, non-governmental organizations, and community representatives. One of the key priorities outlined in the White Health Paper is the need to improve access to healthcare services, particularly in rural areas in Sarawak. So this paper highlights the importance of strengthening primary healthcare services, including community-based healthcare, to ensure that people in remote areas can access healthcare services when they need them. This includes providing training and support to community health workers and improving the availability of basic healthcare infrastructures, such as clinics, mobile health units, and telemedicine services. Another priority identified in the White Health Paper is the need to address the burden of non-communicable diseases (NCDs) such as diabetes, hypertension, and cancer. The paper outlines a range of strategies to prevent and control NCDs, including health promotion campaigns to raise awareness of risk factors, early detection and screening program, and the promotion of healthy lifestyle choices. The White Health Paper also highlights the importance of improving mental health services in the state, particularly for children and adolescents. In addition to these priorities, the White Health Paper also outlines strategies to improve healthcare infrastructure, workforce development, and health financing. This includes the development of a robust healthcare financing system to ensure sustainable and equitable healthcare for all, as well as investments in healthcare infrastructure and technology to improve healthcare delivery and patient outcomes. One of the key priorities outlined in this White Health Paper is the need to outline strategies to improve healthcare infrastructures, as well as providing a comprehensive roadmap for the development of healthcare policies and programs in the state. The document reflects a commitment by the state government to improving the health and well-being of the people in Sarawak and promoting sustainable and equitable healthcare for all. So far, that's all the updates that I have for today. We return to the studio. Thank you, Yusuf.
Thank you, Lorenzo. Now, on to our next news. The Health Ministry would maintain the existing Standard Operating Procedures SOP related to mask-wearing regulations as part of preventive measures against COVID-19. And as such, wearing face masks in most public places should remain optional, despite the possibility of a case surge. Minister of Health Dr. Zaliha Mustafa said rather than making it compulsory, individuals who show symptoms are encouraged to take the necessary precautions, especially in public areas and workplaces, and not risking the vulnerable groups.
Saya akan berbincang dengan Ibu Fadila untuk melihat daripada garis panduan yang kita akan berikan kepada guru dan kanak-kanak di sekolah. Kanak-kanak ini dia adalah mudah terdedah, dan bila balik sekolah itu dalam keadaan yang mungkin ramai dan bersesak, so kita minta supaya garis panduan itu diikuti nanti, insyaAllah.
She was met by reporters after paying a courtesy call to the Premier of Sarawak, Datuk Patinggi Tan Sri Abang Johari Tun Openg at Wisma Bapak Malaysia. Now, congested hospital has been a long-standing problem for Sarawak's healthcare. In an attempt to resolve this, Minister of Health Dr. Zaliha Mustafa said her ministry are in talks with the state government in establishing new hospitals and healthcare facilities around Sarawak, including the state's own cancer centre, with the main goal of increasing the general health of Sarawakins.
Yang kita boleh bekerjasama antara pusat dan juga negeri untuk mempertingkatkan perkhidmatan kesihatan di Sarawak ini khususnya. Kita juga berbincang tentang manpower contohnya, dan kita juga melihat perkara ini adalah satu perkara yang penting untuk memastikan health workers di Sarawak ini mencukupi untuk memberi perkhidmatan yang terbaik kepada rakyat di Sarawak. Dan kita tidak hanya berbincang tentang membina hospital baru atau fasiliti baru dan sebagainya. Untuk memastikan rakyat sihat juga, kita kena melihat dari sudut primary care, wellness dan sebagainya.
The majority believe that wearing face masks in public and crowded areas could help lower the risk of transmission and the severity of symptoms. And some have also expressed that donning of the face mask should remain optional despite the possibility of a COVID-19 surge. Deputy Premier cum State Disaster Management Committee SDMC Chairman Dato' Ahmad Douglas Uga Ambas announced that the state government is currently awaiting the official decision from the federal government on making face mask wearing mandatory once more.
Yes, I think it's important because I bisa protect I punya badan. Walaupun tak ada COVID macam sekarang kan, kita mesti pakai masker sebab debu saja itu ada bakteri, kuman segala macam. So, menurut saya mask itu sangat penting, very important.
I'm always have been and will be wearing on my mask for my own personal use. I think, in my personal opinion, I think mask is vital. Even though it is not compulsory, I should say everyone should put it on, and for one's own safety. That's not telling you to get it, And then things are getting very, very widely spread out now, and it's rampant everywhere. Nobody knows when and where they're going to get it. I think it's safer to put it on.
For me, I think it's not really important because nowadays, I think we already take a vaccine, so it's not as dangerous as before.
我觉得 face mask 很重要，因为它会保护我，还保护我的家人。因为 vaccine 了不代表说真的是完全免疫嘛，所以我还是要戴着口罩保护自己了。
A total of 12 cases of the Actaris variant, a subvariant of Omicron, a variant said to be highly contagious and less susceptible to vaccines, have been detected, with 6 of them detected in Sarawak. On to our next news. Bintulu Development Authority BDA issued a notice to the public of the temporary road closure of diversions at a section of Jalan Abang Galau for the ongoing construction works. The construction work will begin on April 29th from 9:30 p.m. to 6 a.m. Road users are advised to drive with caution in this area and follow posted detours. The alternative route provided towards the left side into the Park City Commerce Square area, and the Bintulu-Jepak Bridge project is part of the second trunk road project, fully funded by the state government, and involves constructing a permanent cable span bridge of 494.2 meters across the Kemena River, along with roads and viaducts. The completed bridge will provide a shorter distance for travel from Jepak to Bintulu town centre. This is TVS News at 5. 4 men, including 2 brothers, pleaded guilty in the Pontian Magistrates Court on Thursday, April 27th, to charges of criminal violence and causing injury to a police officer near Kulai, Johor, on the morning of the first day of Shawwal. Khalid Khamis, 38, Muhammad Effendi Muhammad Said, 40, and his brother Muhammad Fazli Muhammad Said, 24, were charged together with using violence against Corporal Muhammad Hasrul Muhammad Namiri with the intention of preventing him from carrying out his duties.
The incident occurred around 3 a.m. on the morning of first Shawwal at kilometer 7 Jalan Kulai towards Kota Tinggi near Kulai. Khalid, Mohammed Effendi and Muhammad Fazli were charged under Section 353 of the Penal Code, which carries a maximum sentence of 2 years in prison or a fine or both if found guilty. Meanwhile, Muhammad Haikal was charged under Section 323 of the Penal Code, which carries a maximum sentence of 1 year in prison or a fine of up to 2,000 ringgit or both if found guilty. Magistrate Nur Azuin Abdul Muati allowed Muhammad Haikal to be released on a bail of 1,500 ringgit with one surety, while the other 3, Khalid, Muhammad Effendi and Muhammad Fazli, were each allowed to be released on a bail of 2,000 ringgit with one surety. The court set April 30th for sentencing at the Kulai Magistrates Court. The prosecution was led by Deputy Public Prosecutor Nur Izzati Zaini, while all 4 accused were unrepresented by lawyers.
More on COVID news. The number of COVID-19 deaths has gone down 95% since the start of 2023, according to the World Health Organization Chief Tedros Adhanom Ghebreyesus on Wednesday.
In a press briefing, Ghebreyesus said the WHO is content with the continuous decline in the number of reported deaths due to COVID-19. However, Ghebreyesus stressed that the threat of the pandemic is far from being resolved, as the virus could still mutate and cause new waves of death. Ghebreyesus explained that as the emergence of the new XBB.1.16 variant illustrates, the virus is still changing and is still capable of causing new waves of disease. He said an estimated 1 in 10 infections results in post-COVID-19 condition, suggesting that hundreds of millions of people will need longer-term care. He still remains optimistic about the possibility of WHO declaring the end of the global COVID-19 pandemic in 2023. According to the WHO tally as of April 26, over 764 million cases of COVID-19 has been confirmed since the beginning of the global pandemic, while nearly 7 million people have succumbed to the disease.
See the world closer with TVS as we bring you the latest news updates, both locally and internationally, just a click away by heading on to our website at www.tvstv.my or by following us on our social media platforms. And that's all the time we have for TVS English News at 5. My name is Muhammad Yusuf. Thank you for watching and Selamat Hari Raya. Maaf Zahir dan Batin. Take care.